Today, almost 2.5 million non-elderly Wisconsinites have some type of pre-existing health condition, including over 300,000 children. And now, because of the Affordable Care Act, they have the protections that they didn't have before and can't be denied coverage because of a pre-existing medical condition. Let me tell you the story of one Wisconsin family. Stephen Jordheim from Grand Chute contacted my office recently to tell me that his young 27-year-old daughter with a pre-existing condition had finally been able to purchase private insurance thanks to the Affordable Care Act. When she was 14, she contracted food poisoning and had severe complications that eventually developed into gallbladder disease and other conditions. Due to these pre-existing conditions, she has been unable to purchase health insurance on the market. And all of her life decisions have been driven by the need to be either a full-time student or to stay on her father's health care plan. She finished school a year ago and is a successful freelance musician. Without the Affordable Care Act, she would have to take a position outside of her chosen field in order to have a health care plan under an employer. But now, because of the Affordable Care Act, she's able to continue with her career and pursue her dreams. She recently enrolled in her own plan on healthcare.gov with a national provider network. Her parents had been worrying about their daughter getting her own insurance for 13 years. But now they can rest. They can rest easy, and they're very thankful for the Affordable Care Act. The Jordheim family is not alone. There are hardworking families across our country that now have peace of mind, knowing that they will have quality health care coverage that they want and need. Before the Affordable Care Act, more than a third of people who shop for health care in the individual market were turned down or charged a lot more because of their pre-existing conditions. Because of America's new health law, for the first time, insurance companies will be prohibited from denying health coverage for Americans with pre-existing conditions, and conditions such as cancer, asthma, or diabetes. Insurance companies will also no longer be able to charge higher premiums based on health status or health history. In the United States of America, health care should be a right guaranteed to all, not a privilege reserved to the few. That vision has guided us for decades, but now we have begun to write it into our laws. And that is what we have fought for and will continue to fight for as we move the Affordable Care Act forward.